So, good morning, all. My topic is analysis of visual field progression between pseudoexfoliation glaucoma and primary open angle glaucoma. And glaucoma remains the leading cause of irreversible blindness worldwide. And among its subtypes, primary open angle glaucoma and pseudoexfoliation glaucoma represent entities with distinct epidemiological and pathological features. In primary open angle glaucoma, it is a chronic optic neuropathy with open angle, and pseudoexfoliation glaucoma is a secondary glaucoma due to pseudoexfoliative material deposition. It can be closed or open angle glaucoma. And pseudoexfoliation glaucoma linked with higher IOP, greater diurnal fluctuation and faster progression, and functional assessment via visual field analyzer remains the gold standard. Aim of the study was to compare the rate of visual field progression among patients diagnosed with pseudoexfoliation glaucoma and primary open angle glaucoma. Visual field index and mean deviation was used for functional assessment and progression analysis using Humphrey field analyzer. It was a retrospective cohort study including 30 pseudoexfoliation patients and 30 primary open angle patients. And age, visual field index and mean deviation across 3 visits were recorded. And statistical analysis using paired t-test was used to evaluate within group changes and unpaired t-test to compare progression between two groups. Inclusion, it was a reliable HFA test for more than or equal to 3 visits, visual acuity more than 6/60, confirmed diagnosis of primary open angle glaucoma and pseudoexfoliation with open angles, and excluded were visual acuity less than 6/60. All other types of glaucoma, including pseudoexfoliation with closed angles, insufficient information, history of ocular surgery, diagnosed with uveitis, keratopathy, trauma to the eye, and during the study period, no significant lens opacity developed or no surgery was performed which would enhance vision. And by our study, we concluded that pseudoexfoliation patients were significantly older with a mean age of 78.3, and in primary open angle glaucoma, mean age was 69.8 and a significant p-value of less than 0.001. And this is the graph showing visual field index progression analysis. And in pseudoexfoliation glaucoma, the visual field deteriorated from 85.4 to 81.3 and then to 78.4. And within the group, it was a significant with a p-value of less than 0.001. And in case of primary open angle glaucoma, the value diminished from 79 to 77.3 to 75.9 with a significant p-value of less than 0.01. And comparing the intergroup comparison, the p-value was less than 0.001, indicating a significant decline in pseudoexfoliation patients compared to primary open angle patients. And similar curves were obtained for mean deviation progression. This in pseudoexfoliation group, it declines from minus 6.8 to minus 8.3 and then to minus 10.2 with a significant p-value of less than 0.001. And in primary open angle group, it declined from minus 7.7 to minus 8.6 and then to minus 9.9 with a p-value of less than 0.001. And in the group comparison also showed a significant difference of p less than 0.001, indicating a progression in pseudoexfoliation group than the primary open angle group. And pseudoexfoliation patients showed faster progression in both VF5 and mean deviation compared to primary open angle group, and it represents a systemic process associated with increased cardiovascular and cerebrovascular morbidity. Endothelial dysfunction and vascular dysregulation worsen optic damage, and pseudoexfoliative material obstruct trabecular meshwork, which leads to increased IOP. And oxidative stress may play a great role in accelerated progression. And comparing the study with other studies, our study was a retrospective study including 30 primary open angle versus 30 pseudoexfoliation patients, and 3 HFA visits were taken and visual field index and mean deviation progression was checked. And in the study by Ayala et al., it was a longitudinal visual field study comparing primary open angle group and pseudoexfoliation patients. And in Khalil and Gupta study, it was a comparative visual field progression study. And in our current study, pseudoexfoliation showed steeper decline in visual field index and mean deviation. And in study by Ayala et al., annual mean deviation loss in pseudoexfoliation group was minus 0.36 decibel per year versus in primary open angle group it was minus 0.24 decibel per year. And in Khalil and Gupta study, pseudoexfoliation showed more rapid visual field deterioration than primary open angle glaucoma. All three studies concluded that pseudoexfoliation progresses faster and has a faster functional decline and require shorter review intervals. It was a limitation. It was a small sample size study and time period between respective perimetry vary for plus or minus 1 to 2 months among patients, and it relied exclusively on functional testing without incorporating imaging modalities like OCT. And to conclude, PXFG demonstrates significant faster visual field progression than primary open-angle glaucoma and emphasizes need for aggressive management and frequent monitoring and management strategies for pseudoexfoliation, including lower IOP targets, earlier surgical intervention, and more frequent follow-up testing. And it also highlights the importance of tailoring treatment approaches according to the glaucoma subtype. And pseudoexfoliation demands lower IOP targets than primary open-angle glaucoma. Combination therapy is often indicated at diagnosis, and it requires closer follow-up and earlier surgical consideration, as it is unlikely to control medically. So my references. Thank you.
Variable which leads to progression, if progression is being judged on two cohorts, the variable that leads to progression is adequacy of control. Yes or no?
Yes.
That is not stressed in the study. You have never touched upon what drugs you gave, how many drugs you gave, what target pressure you set for both the cohorts. You never touched upon. You just said that PXF will go. Obviously, a secondary open angle glaucoma will go faster than a primary open angle glaucoma. That is expected. Even if that PXF has been PDS, I am sure the same result would have come. So that way you'll have to slightly change the design so that you look at the variable from the point of context of what you are studying. Okay.
Doctor, what could be the reason for this faster progression in pseudo exfoliation? What are the possibilities? Why do you get faster progression?
Because there is pseudoexfoliative material development leads to increased IOP, and it also has systemic effects.
The reason, because you told PYAG progression is comparatively less compared to exfoliation, pseudo exfoliation. Any specific reason for that progression? Because everyone knows that secondary, as you told, no, secondary glaucomas are notorious. Okay, you are a PG, no? What is true exfoliation? You are told pseudo. What is true exfoliation? In which case you can have true exfoliation? You know, that is, hello, glass blower cataract. Glass blower cataract, infrared radiations can produce changes in the capsule. That is called true exfoliation. You should know this. Okay. Good, thank you.
Thank you.